Hi, my name is Terry Bennett. I'm a child psychiatrist at McMaster Children's Hospital in Hamilton, Ontario, which is located within the traditional territories of the Haudenosaunee and Anishinaabe people. When I first started as a child psychiatrist about 10 years ago, it was a time when our job started to get pretty busy. Often I'd find myself on call in the emergency room, talking late into the evening with 15-year-olds and 16-year-olds. Now, typically in the emergency room, you're focused on the here and now of what's happening that brings them in that particular evening. And so often it was pretty serious concerns that had actually been going on for quite a while, problems with severe depressive symptoms, suicidality, or self-harm. One of the things while we were talking about the here and now, we would drift towards talking about, well, when did you first notice when things didn't feel right to you? And what struck me conversation after conversation was how often youth would talk about how things really started to feel kind of not right around grade 6, grade 7, around the time when their emotions started to become difficult to understand, and life with respect to school, peer relationships, expectations had suddenly become a lot more complicated in many ways. Talking then to their families, we could back up even further. And families would often say that, in fact, they'd had worries kind of a lot earlier, sometimes as early as the preschool years. But they weren't really sure who to talk to about it. And on top of that, families themselves often had been struggling with really quite severe challenges, like things like poverty, things like income inequality, trauma, worried about safe neighborhoods, and parent mental illness. We call these the social determinants of health. What became clear then was that although the emergency room was and is a very important place when it comes to youth mental health, we all agree that it shouldn't have been the first place that kids were coming to at age 15 or 16 when their problems had been going on for so long. We know that about 1 in 5 kids will have significant difficulties with mental health in Canada, and anywhere from 20 to 30% of these are able to access the mental health services that they need. Things have been exacerbated even further as we work our way out of this COVID pandemic and its significant impact on child and youth mental health. And thinking about these stories from the emergency rooms really made me think about some of the ways in which we need to think about recovering with respect to youth mental health services in the pandemic. First of all, it's really important that we start thinking about things much earlier with a focus on prevention so that youth mental health can be grown over time. Researchers who study how kids grow up over time would tend to agree with what families and youth were talking about as they reflected backwards on their own experiences. For example, prevention programs that are offered during the early preschool years, particularly that focus on family health and positive parenting, can have cascading effects over time into adolescence. It can improve, it can help elementary school children improve their emotional self-regulation, which in turn has effects on decreasing suicidality and substance use, and also improving mood and anxiety problems into the teenage years. Similarly, as we think about that transition to adulthood, thinking about backing things up to pre-adolescence when prevention programs have also shown longer term effects into the adult years when they're offered during the middle school years. Prevention is important, and so is an ecological approach to youth mental health. While formal mental health diagnoses are pretty important, we need to really think about youth's ecologies, and that's the daily experience of kids' environment as they grow up. For example, family mental health, relationships, their connections to school, and policies that either decrease or exacerbate income inequality and social exclusion. When we think about the social determinants of health, which are arguably the most powerful influences on kids' mental health as they grow towards youth, we need to assess them regularly and act upon them in meaningful ways. And finally, these types of approaches need to be baked into our mental health system. Early disparities and mental health challenges start early, and they can have a tendency to cascade over time. We need to level the playing field in order to make an impact as we recover from this COVID pandemic on youth mental health. Thanks very much.